I will now be talking about the conduction system of the heart and how the conduction system of the heart relates to the electrocardiogram. The cardiac conduction system consists of the sinoatrial, or SA node, located in the right atria near the entrance of the superior vena cava. This is the natural pacemaker of the heart. Electrical impulses from the SA node spread throughout both atria and stimulate them to contract. The atrioventricular, or AV node, located on the other side of the atria near the AV valve. AV node serves as the electrical gateways to the ventricles. They delay the passage of electrical impulses to the ventricles. This delay is used to ensure that the atria have ejected all the blood into the ventricles between trying to contract. The AV node receives signals from the SA node and passes them onto the atrioventricular bundle, or bundle of His. The bundle is divided into right and left branches, bundle branches, which ends up sending electrical impulses toward the apex of the heart. And signals are passed through the Purkinje fibers. Turning increases in speed, spreading through the ventricular myocardium. These electrical activities of the heart can be recorded by the electrocardiogram, or ECG, or EKG. An ECG composite recording of all the action potentials produced by the nodes and cells of the myocardium. Each wave of the ECG corresponds to a certain event of the cardiac electrical cycle. When the atria is full of blood, the SA node finds electrical signals spread throughout the atria and depolarizes them. This is represented by the P wave. Atrial contraction, or systole, starts after the P wave begins. The P to Q segment represents the time the signals travel from the SA node to the AV node. The QRS complex marks the beginning of marks the firing of a node and represents ventricular depolarization. The Q wave corresponds to depolarization of the intraventricular septum. The R wave produced by the depolarization of the main mass of ventricles. The S wave represents the last piece of the ventricular polarization at the base of the heart. Atrial repolarization also occurs during this time, but the signal is obscured by the large QRS complex. The ST segment represents the plateau myocardial action potential. This is when the ventricles contract and pump blood. The T wave represents the ventricular repolarization immediately before ventricular relaxation, or ventricular diastole. This repeats with every heartbeat.